Where do we stand right now, just in terms of this wave, how much more we can anticipate, and what the real end effect's going to be?
Yeah, Becky, good morning to all of you. So we are optimistic looking at data coming out of the Northeast and Mid-Atlantic that we're seeing peaks. And that's also reflective not just in daily cases, which are declining, but also wastewater surveillance, which is now becoming a very kind of accurate way of determining a population's proportion of COVID cases. So that's hopeful. But to your point, when we have upwards of 750,000 cases reported yesterday, which is an undercount, as we've talked about, that just leads to, even if it's less than 1% of hospitalizations, we have deaths that follow. So you're absolutely correct in pointing out the grim reality. We've seen more deaths, unfortunately, during this surge, in a compressed amount of time than we had over previous 3 months. So it's literally a statistic of how many people are getting COVID, how many people are not boosted, because the majority of those deaths, Becky, are still in unvaccinated. And when there are breakthrough deaths, they're in people who had not been boosted.
So the good news being that we could be getting to the end of this wave, at least in the areas that went into it first. What happens around the rest of the country? Are we going to be kind of facing a rolling wave?
Yeah, so if there is good news to be had about Omicron, it's that as fast as it comes up, you see that rapid decline. That's reflected in the peaks that we saw in South Africa and what we're seeing in the UK, which we generally trail by a couple of weeks. So keep an eye out in the next 2 to 3 weeks on the Midwest. Minnesota, who is still kind of recovering from their Delta surge, still seeing Delta cases in the hospitalization rates, are also now picking up much more Omicron. So we're going to watch the Pacific Northwest, the Midwest, and we're already seeing surges, but they have yet to reach their peaks. Keep an eye out also on Texas and Florida, huge positivity rates, but not clear signs that they've peaked just yet. And those states drive big numbers because of their population.